First, we want to use the CARE strategy, which is calming the nervous system, activating core stability, retraining movement patterns through graded exposure, and then helping with education and empowerment through understanding pain neuroscience. So we're going to go through this CARE approach and give you some strategies that you can use to work with this pain pattern. So movement is medicine, and we don't want you to completely limit your movement. So we'd like you to start walking 10 minutes a day. You don't need to walk up hills. You can walk on flat ground. Walk wherever you're most comfortable and try and do that for 10 minutes a day. When you're doing the walking prescription, your pain should not get worse. So if your pain is at a 3 out of 10, it should stay there. If it's a little bit higher, it shouldn't get any worse than it currently is. So some discomfort is normal with walking, but pay attention and make sure that you're not having any severe pain with this walking protocol. And then if there's no significant increase in your pain doing this, you want to increase the amount of walking by 5 minutes a week. So week 2 would be 15 minutes and so on. And then you want to monitor your recovery. You should be able to recover from the walking within a couple hours. It shouldn't set you back. And so our goal is to reach 30 minutes by month 2. Once you hit 30 minutes, you can stay there. You don't have to keep increasing the amount that you're walking. But this is your initial strategy for improving what's going on in your back. So next, we're going to go into some core stability exercises. I would start with this supine march here. So this woman is laying on her back with her legs up, and then she's basically going to march in place. So she's going to bring one leg down and then back up, and then the other leg down and back up, back and forth like that. And doing that within your comfort level. I would start small with this. So maybe 3 to 5 on each side, maybe a few times a day, not all at once, and just get used to it. So the bird dog is the next one, and this one is a little bit more challenging for most people. It doesn't look like this video is going to load here, but you have one leg going back, and then you have the opposite arm going forward. And so this can be a lot for people initially. So what I would recommend is if you can get in this quadruped position on all fours, just start with the arm. Bring the arm up and then back down and up and down, switch sides, and then just do the legs, bringing the legs up and down, and do that for about a week. And then build up to being able to move the arm and the leg at the same time. And I would say similar to the supine marching, 3 to 5 on each side at a time and up to 3 times a day. So next, let's talk about the mind-body connection. So one of the things that it seems like has been wired into our brain is that pain equals damage. And this isn't entirely true. Pain is basically an alarm system. And so, sometimes the alarm goes off when there's no tissue damage. The alarm is basically there because the system feels threatened in some way. And this threatened system can be physical with the movement, but it can also be mental or emotional, or stress will increase the way that we perceive threat in our environment. And so oftentimes if you have chronic pain, if you've been going through this for a long time and you've had MRIs and ultrasound and x-rays and lots of evaluations and they can't really find anything wrong, there's usually a neurological component where your brain is no longer using the descending inhibition that it normally uses to dampen the pain signals. And so it can be helpful to utilize some strategies that help you kind of rewire your brain here. So, um, basically, if you've done these exercises and this program and the breathing and everything for about 2 weeks, and you're not really noticing any improvement, there usually is some slight improvement, but people have expectations they're going to have some significant improvement. So if you're having no improvement at all, and you're still feeling very fearful about movement, and there's any signs of inflammation still, whether those are lab findings or imaging findings, and then if there's any new neurological symptoms, so any tingling or numbness, then it would be appropriate for you to be referred somewhere. I'm not your doctor, so I'm not referring you anywhere, but it would be important to talk to a medical professional. This could be a pain psychologist that specializes in CBT or ACT. This could be your primary care physician. They could review your medication and see if there's some other options there. It may be a social worker, depending on what the barriers to effective care are, or maybe an advanced physical therapy subspecialty, especially somebody who's trained in McKinsey. That would be really helpful for you. So, as we discussed, complex back pain is inconsistent. There's inconsistent findings, and there's some psychological or psychosocial factors that are influencing the pain. So what we're doing in this program is giving you gentle movements, some core strengthening, helping you understand what pain means, and trying to increase your body's resilience and capacity to deal with the pain that you're experiencing. You're going to be monitoring yourself closely during this time and ensuring that as you increase your activity, that nothing out of the ordinary happens that would require you to go to urgent care, go to the emergency room. So I just want to end on this note that there is a path forward. I've seen a lot of people with this complex pain pattern who have been consistent over time and have been able to break out of it. So I hope that these resources are really helpful for you, and that you are one of those who is able to break out of this pain pattern.